The femoral vein, as you have seen, is closely related to the femoral artery. Just as we have already discussed, it passes through the femoral triangle alongside the femoral artery. It is a major deep vein of the lower limb that becomes the external iliac vein when it passes under the inguinal ligament to enter the abdomen. Here you can see the femoral vein alone in the region of the thigh. Here you can see the tributary of the femoral vein, the great saphenous vein, pass through the saphenous opening and move toward the superficial fascia of the thigh. Just like how the femoral artery gives off many branches that we discussed earlier, the femoral vein receives many tributaries, meaning that many small veins drain into the femoral vein. Tributaries the femoral vein receives are the great saphenous vein. It is a major superficial vein in the region of the thigh. Veins accompany three superficial branches of the femoral artery in passing through the saphenous opening. That are the superficial epigastric vein, superficial circumflex iliac vein, and superficial external pudendal vein. There are also the veins accompanying the three deep branches of the femoral artery. That is the profunda, deep external pudendal, and muscular vein. These deep branches are found within the femoral triangle. Here are the lateral and medial circumflex femoral veins. This here is the descending genicular and muscular veins in the adductor canal. The femoral vein plays an important role in the circulatory system by returning blood from the lower limb to the heart. The blood flow in the femoral vein is in the direction of the heart, meaning it flows from the lower limb to the heart. The femoral vein is a deep vein, meaning it is located deep within the thigh and is surrounded by muscle. Because of this, it is less likely to be affected by blood clots than more superficial veins. Importance of femoral vein in medical procedures such as catheterization and dialysis. The femoral vein is commonly used for access in medical procedures such as catheterization and dialysis, as it is a large vein that is easy to access. In catheterization procedures, a catheter is inserted into the femoral vein and then threaded through the body to reach the heart or other organs. In dialysis, a catheter is inserted into the femoral vein and used to access the bloodstream to remove waste products from the blood.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.